Maybe you've started to worry about your prostate lately. You've felt something you don't really talk about because it feels too private. But it changes your day quietly. You find excuses to visit a place you never really liked anyway. The restroom. You know where every bathroom is before you enter a store. You avoid long drives unless you feel empty enough. You skip water before meetings because you want to stay in control. Could it be your prostate bothering you? Let's find out. I'm Dr. Stefan Buntrock, one of the most copied urologists on YouTube. I get these questions frequently. Many men know the prostate can cause these symptoms, but this may not be the whole story. The prostate is a gland beneath the bladder most men are unaware of until it causes trouble. With age, it can enlarge. It can squeeze the urine channel a bit. That changes how your bladder behaves. When you rush to the bathroom, it may be one of the signs, but urinary urgency is not a verdict, and the prostate is not always the reason. Nobody teaches that to men. Urinary bother can be manageable, and the thought of seeing a urologist can feel unsettling. That's understandable, and you're not alone in this. In my office, many men feel relieved when their worries turn out to be unfounded. Here's the truth nobody tells you. Often, bladder trouble is harmless. It could be a urinary tract infection, it could be age, or maybe you're simply drinking too much water. You might be asking yourself now, why should I even see a urologist? Just to make sure there is nothing to worry about. We are trained for this moment. The moment a man gathers his courage and asks for help. Because urology has something real to offer. Relief, especially from those embarrassing moments. When you go for the 5th time and your friends start joking about your weak bladder. When urgency hits you right there in the middle of the row in the opera. No way out. So let's break down what your body is trying to tell you. The main drivers of urgency are well known and highly manageable. Prostate enlargement is one of them, but often it doesn't cause any trouble. Even though it may seem logical, I frequently see only a weak correlation. Men with large prostates are often fine. Men with small prostates, on the other hand, can be troubled. The real cause may be somewhere else. Overactive bladder signals that fire too early, pelvic floor tension that mimics fullness, poor sleep that heightens sympathetic drive, or the habit loop of rushing before the bladder is ready. It could be incomplete emptying. We call this residual urine. It could even be something seemingly unrelated, like diabetes. All of these conditions can be treated effectively. Many men worry when they hear the words tablets or surgery, but treatment is not always what you imagine. Medication for urgency is often gentle and targeted, designed to calm the bladder's signaling system rather than override it. Think of it as lowering the volume, not forcing a change. Some men only need it for a short phase until the bladder resets. Surgery is even more misunderstood. Most procedures today are minimally invasive, quick, and focused on restoring flow, not removing anything essential. They are reserved for cases where the blockage is clear and the solution precise. The real goal is to match the treatment to the cause, so you get relief without unnecessary steps. The male bladder is not fragile, it is responsive, and responsiveness can be reshaped. Once you understand how urgency works, something inside you loosens. Clarity dissolves fear. Small shifts matter more than force. A short delay teaches your bladder that danger is gone. Low breathing reduces the nervous system's grip. Steady drinking restores rhythm. Relaxing the pelvic floor rewrites the tension map. Deep sleep calms signals that fire too soon. Your bladder learns quickly, faster than you expect. And when it feels safe again, urgency steps back. And maybe the next step is simply this. Talk to a urologist. Medicine is not a failure. Your bladder is not a failure. It is a signal. Sometimes this is the moment you finally start hearing what it has been trying to tell you. Share this video with your friends. Like and subscribe if it helped you. I'm Dr. Stefan Buntrock, always copied, never matched.